Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. Another year of innovation in healthcare. As the pandemic continued to impact the healthcare field via staffing and resource challenges, there were areas of growth in health informatics to help find ways to improve these ongoing issues. So in this podcast episode, the last episode of 2022, I'm going to go over some areas I'm excited to continue to watch develop in 2023 and beyond. As always, I would love to hear from you. Which trends in health informatics are you most excited to see develop in 2023? So the first trend that I saw was the integration of genomics data into the electronic health record system. As we continue to learn more about genomic data, there's a growing push to integrate an individual's genetic blueprint to help guide their treatment plan. For example, to have a better sense and understanding of how they might react to certain drugs. Interoperability and standardization challenges have been reported as one of the barriers to fully integrating genomic data into the electronic health record system, so it's easily accessible to view by clinicians. However, Meditech, a popular EHR vendor, recently announced that they would be integrating patient genetic data into the clinical workflow of their electronic health record system. So I am personally excited to see how the field of genomic data and precision medicine will continue to evolve as genetic testing becomes more cost-effective, mainstream, and generally accessible to the population. So another trend that I was excited to see grow in 2022 was the area of natural language processing in healthcare. So recently, Google Health announced that they would be integrating Care Studio into Meditech to leverage the use of natural language processing with its advanced search functionality and the ability to group and sort relevant conditions for clinicians to easily access. So this is what I hope to see more of: big tech companies which are making moves in the healthcare space, such as Amazon, Google, and Microsoft, partnering with electronic health record vendors and clinical stakeholders, which are already integrated into hospital systems, who already have that key knowledge transfer from clinicians, using their technology in a collaborative way instead of just, big tech moving in and defining how health standards should be, working in a collaborative way with already existing systems and individuals to create systems that are actually functionable. Another trend that I've seen exploding in 2022 is the area of health equity. So health equity is an area which seems to be getting more and more coverage, especially an interest in tracking social determinants of health data, whether that be in research studies or within the electronic health record. Unfortunately, your zip code or where you're based has a real impact on your health, and taking a more holistic view of health by looking at these social determinants of health, I believe is very important. In addition, there's been more work done in ensuring that artificial intelligence algorithms that are used in healthcare are equitable and are tested on diverse groups of people to help produce biased results, which often has negative effects for marginalized groups. For instance, there has been a push to review the controversial race-based correction factor from an algorithm used to diagnose people and determine if medication should be administered for kidney disease. I had the opportunity to attend an event by One Health Tech from the Data Science for Health Equity community. It was a great event where people could collaborate from all over the world to discuss how can we develop technological solutions in healthcare without leaving people behind. Another resource I was exposed to this year was also a framework for health data governance developed by Transform Health, which is a comprehensive overview of core elements to think of when working with health data. For example, building community relationships, data security when it comes to collecting sensitive social determinants of health data elements. So these are a few areas that I'm really excited to see grow in 2023. Genomics data integrating into the electronic health record, natural language processing, and health equity. And again, I'd love to hear from you. What areas are you really excited to see grow in 2023? And I want to talk about the structure of the Health Analytic Insights podcast going forward in 2023. So this year we celebrated 50 episodes of the podcast. And in 2023, we're going to change up the format to do a more deep dive into healthcare metrics and understanding how the metrics are measured by different hospitals, different countries, and through different technologies. So from January to March, I'm going to do a deep dive into readmission rates back into hospital. From April to June, I'm going to look into hospital wait times. And then from July to September, we're going to look at patient satisfaction scores. And then October to December will be a wild card. But I think it'll be interesting to really do a deep dive into some of these common metrics, which are collected by multiple different hospital systems, see how they're being collected, and get a sense of how these metrics are being impacted. So look for that in 2023. I hope you have a wonderful holiday. And as always, thanks for listening to the Health Analytic Insights Podcast. Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.